In an era where high-tech equipment and sterile design dominate medical spaces, an unexpected healing tool is gaining recognition in hospitals around the world: digital nature murals. These large-scale displays, featuring forests, waterfalls, meadows, or tranquil coastal scenes, are not merely decorative. Growing evidence shows that visual exposure to natural imagery within patient rooms can meaningfully impact recovery outcomes, including reduced pain perception, lower stress levels, and even shorter hospital stays. In a setting where emotional resilience is often as important as physical care, the presence of calming, immersive visuals may offer a powerful, low-cost adjunct to conventional treatment. The psychological impact of nature scenes, even when mediated through screens or printed murals, is rooted in the human brain's deep evolutionary connection to natural environments. This principle, known as biophilia, suggests that humans are innately drawn to natural patterns, colors, and landscapes because they signal safety, nourishment, and life-supporting conditions. In the high-stress context of hospitalization, where unfamiliar routines, physical discomfort, and uncertainty prevail, artificially introducing these natural elements can activate a restorative mental state. Patients who view digital murals of serene nature scenes often describe feeling calmer, more grounded, and better able to cope with pain and anxiety. Scientific studies have begun to quantify this effect. In controlled trials, patients recovering from surgery or undergoing painful procedures reported significantly lower levels of perceived pain and anxiety when placed in rooms with nature murals, compared to those in standard hospital environments. One key mechanism appears to be distraction. Vivid, engaging visuals draw the mind away from discomfort and into a form of soft fascination, a psychological state in which attention is held without effort. This not only eases mental fatigue, but may also alter the subjective experience of pain, allowing patients to require less pharmacological intervention for relief. Beyond immediate comfort, nature imagery also appears to influence physiological markers of healing. Several studies have found that patients exposed to natural views, whether real or simulated, show lower heart rates, reduced blood pressure, and improved mood. These shifts are consistent with activation of the parasympathetic nervous system, which promotes rest, digestion, and immune function, all essential processes for recovery. In some hospitals, patient rooms featuring large digital murals or LED nature panels have been associated with measurable reductions in average hospital stay durations, suggesting that these visual interventions can support faster recuperation when used as part of a holistic care approach. Importantly, the effectiveness of digital nature murals does not seem limited by their artificial nature. While actual views of trees or gardens are ideal, many hospitals lack the architecture or landscaping to provide such access. Digital displays offer a flexible and customizable alternative capable of bringing tailored imagery into any room. Advances in screen resolution, lighting, and image realism allow for increasingly immersive experiences, with some installations synchronized to the time of day, showing soft morning light, midday brightness, or dusky sunsets that align with natural circadian cues. This can further enhance sleep quality and orientation, particularly in patients experiencing confusion or sensory deprivation. Even staff benefit from these visual elements. Nurses and physicians working in high-stress environments report that nature murals in patient areas improve their own sense of calm and satisfaction, potentially reducing burnout. The soothing presence of greenery or water scenes softens the clinical atmosphere, transforming cold, mechanical rooms into more welcoming and human-centered spaces. As hospitals embrace more integrative approaches to care, the inclusion of digital nature art is becoming part of a broader movement toward healing environments, spaces designed not only to treat illness, but to support the whole person. Whether installed in ICUs, recovery wings, or pediatric units, these murals represent a meaningful way to tap into the healing potential of nature, even when patients are far removed from the outdoors. In sum, digital nature murals are far more than just visual enhancements. They are subtle yet potent therapeutic tools, capable of easing discomfort, calming the mind, and gently accelerating recovery. By harnessing the brain's deep-rooted response to natural beauty, these murals offer a bridge between high-tech medicine and the timeless wisdom of the natural world, a reminder that sometimes healing begins not just with treatment, but with what we see, feel, and imagine.